The following exercises should be helpful if you have a disc tear or a disc herniation. How do you know if you have a disc tear or a disc herniation? The pain began suddenly, without any major injury or accident. It hurts to bend forward even slightly. It hurts to sit even for a few minutes. Coughing or sneezing make it hurt much worse. If your pain fits this description, the most important thing is for you to avoid stretching in a forward direction and avoid pulling your knees to your chest. Doing so can make your situation much worse. Instead, you'll want to do some form of backward bending combined with lying face down as often as possible until you no longer have any signs of a disc tear. If you can't do anything else in this video, at least lie face down for 5 minutes or more each hour. You can put a pillow under your belly and/or prop up on your elbows to make this easier. The way you know it's helping is that the pain will move out of the leg or buttock and into the center of the low back. Or if the pain is already in the center, it will become more focused into a small point. This is what we call centralization. You may notice this happening while lying on your stomach, or you may notice that once you get back onto your feet, the pain has centralized. If you can get the pain to centralize, you're effectively pushing the protruding jelly back inside the disc, safely away from the ligaments and nerves of the spine. While lying on your stomach, try a prone press-up. Place your hands under your shoulders, push your upper body off the bed while keeping your waist on the ground. Press up as high as you can and lock your elbows. You can adjust your hand position to make it less painful if necessary. Breathe out at the top, then lower yourself back down. Do 5 of these in a row. If the pain starts to centralize, or as long as it doesn't peripheralize back out into the buttock or leg, go ahead and do 10 of these and keep going higher and higher each rep. If the pain starts to shoot out into the buttock or leg again, then perhaps it's too early for press-ups. In that case, simply lie on your stomach in the most comfortable manner possible, but slowly challenge yourself to prop up higher and higher on your elbows over the course of the next few days. Again, do not push past the point where your pain shoots further down your leg, or where the pain in your leg gets worse. If the pain still shoots further down your leg, or if the pain in your leg gets worse with this exercise, then contact your doctor or physical therapist for further instruction. Once you're done on your stomach, it's very important that you maintain that inward arch in your lower back as you get off the bed. While on your stomach, slide your body sideways until one leg comes off the bed. Plant that foot on the ground with the knee bent. Complete a press-up while keeping your groin in contact with the bed as you pivot and let your other leg slide off the bed. With both knees bent, keeping your lower back arched inward, push your upper body into an upright position, then stand back up. What you don't want to do is to lift your hips off the table during this transition. This would effectively undo any progress you just made. Here's another view of the correct way of getting back onto your feet. And now the incorrect way. Now if you're up and about and you don't have a place to do the press-up, you can do the standing back extension. Place your knuckles in the center of your low back, where it hurts, and bend backwards as far as you can. Hold for a second and return to an upright position. Do at least 10 of these in a row. Do not pitch forward in between repetitions. If your pain centralizes and improves significantly with these exercises, it's important that you return to a normal posture in your low back, bending neither forward nor backward. Now, in some cases, the pain is so severe on one side that you find yourself standing crooked or limping to avoid the pain. If this is the case, you'll need to correct this problem before you can benefit from the press-ups or standing extensions. If your pain is on the right side, lean your left side against the wall as shown here, with your feet together and both feet away from the wall. Keeping your left shoulder against the wall, Bend your elbow 90 degrees and use your right hand to glide your hip into the wall. Do not push past the point where the pain starts shooting down your leg. Keep nudging at it 10 to 15 times, trying to go further and further into the wall each time. If you can't make any progress in that regard, then lean forward slightly and try the same thing over again. If your pain is on the left side, lean your right side against the wall and glide your hips to the right. Once you've done 10 to 15 reps, spread your feet and touch your foot against the wall, then push yourself back up into a standing position. Keep your hand against your hip as you walk around for a few minutes. Do this side glide exercise every hour until you're no longer limping or standing with a crooked back. If your pain keeps shooting down the leg, no matter how gentle you push, then contact your doctor or physical therapist for further instruction. Aside from these exercises, there are also a few very important instructions to follow. Avoid sitting. Ideally, alternate between walking and lying face down. If you have to sit, maintain that inward curve in your lower back. It may help to stick a rolled up bath towel behind your lower back. Even then, take breaks every 20 to 30 minutes, do a few standing back extensions, and walk around. Avoid bending forward. When you do have to reach for something, bend your knees slightly, then push your butt backward as if closing a drawer with your butt. This will effectively tilt your body forward enough to place your hand where it needs to be without bending from the spine. When carrying something, keep it fast against the core of your body. Once your pain is fully centralized and you no longer have any signs of a disc tear, then click on this link for instructions on how to prevent your back from becoming injured again. If after following these instructions closely, your pain is still going further down your leg, or your leg is getting more numb or weak, or you're having new problems controlling your bowel or bladder, contact your doctor immediately.